Welcome, everyone. My name is Joanie Bouchon. I have the pleasure today again to welcome everyone, and I'm going to be leading the webinar today. I am the Health Profession and Occupation Act lead for the college and also the interim chief regulatory officer. Okay, I'm just figuring out slide control for today. There we go. Okay, wanted to kick us off in a good way by acknowledging that today we are joining you from our Vancouver office, who is located on the ancestral and unceded territories of the Coast Salish people, specifically the Musqueam, Squamish, and Tsleil-Waututh Nation. The college regulates the practice of multiple healthcare profession across the province, and we acknowledge and honor all First Nation territories across those lands. So today's topic are restricted activity and certified practice. I will start by providing a little bit of an historical context. We will review the key regulation that guide the oversight of restricted activity and certified practice under the new Act. And we'll wrap this up by kind of summarizing what's changing and what's not changing on April 1st. And then we should have plenty of time to answer a question. We have received some in advance, and people are welcome to use the Q&A box. We will try to answer as many as we can. So we wanted to start by providing a bit of historical context that is important to understand where we are landing today. So under the Health Profession Act, which is the current act that we are regulating under for 8 more days, there was a draft list of restricted activities that were created. And on the next slide, I'll actually go over the definition of these terms. Those restricted activities were authorized to a profession by being listed in each of the profession regulation. Because currently, even though we have amalgamated as a college, we still have profession-specific regulation under which you can find restricted activity that are granted to the profession. Depending when the profession started being regulated and when they were brought under the Health Profession and Occupation Act and that new model to oversee restricted activity, not all professions actually were granted restricted activity and were brought in under that model. So even though some profession for the longest time had been practicing with a scope of practice that included restricted activity, we unfortunately didn't have a legislative model that were yet reflecting that. So what is a restricted activity? So ministry defines a restricted activity as a narrow defined list of invasive higher risk activities. They must not be performed by any person when providing health services, except if they've been authorized in regulation and further in bylaw. A certified practice is a policy approach that is being used by the Ministry of Health to oversee restricted activity. And it's typically something that is not deemed to be part of the entry-level education of a health professional. So the health professionals are permitted to carry out the restricted activity only if they've been certified by the college of having the requisite competencies. Okay, the key regulation that we will have on April 1st. So I'm going to speak about 3. There's 1 or 2 additional ones, but they're not relevant to the topic that we're discussing today. Even the health profession and occupation regulation is not really directly related to restricted activity and certified practice. It applies to all colleges. It's a bit more admin in nature. It does include the oath of office that all board directors have to take when they start their term on the College Board. But the two really important regulation under HPOA with regards to this topic are the next two on the slide. So the Regulated Health Practitioner Regulation. So it applies to all profession and is primarily a listing of all restricted activity. The second one is the Health and Care Professional Regulation. So that's our college-specific regulation. It includes title, it includes scope of practice, it includes restricted activities, and also if those restricted activities have limits, condition, or also exemption. I'm going to speak to it a little bit more in details, just to provide a better understanding of them. And these are all available on internet if you look for them. So again, the Regulated Health Practitioner Regulation, it is a centralized list of all the restricted activities. So it really, in essence, says those are the things that people need to have authority to perform, and they represent those higher risk activity. The regulation that was published last summer has a list of 66 specific restricted activities. And I'm going to cover in the next slide the categories that are included in there. And health professional must have authority to perform restricted activity that's defined in our college-specific regulation. There are 3 levels of restricted activities. I will also explain them a little bit more. Full, limited, and limited if certified. There are also key exemptions in this regulation. So even though administering Naxolin or oxygen are restricted activities, anyone can do them in an emergency, especially in the case of a drug overdose, and also administering a defibrillator if there's a cardiac arrest. So those are exemptions that actually allows anyone to do those restricted activity in case of an emergency. So what is a full restricted activity? A full restricted activity is when you read the statement in the regulation, if it is authorized in full, it means that a licensee can perform it with no additional authorization and to the full extent that is described. If the authority that is being granted is a limited restricted activity, it can still be performed with no additional authorization. So entry level, you are a full licensee, you are able to perform that activity. But you have to perform it with the limit and condition that are articulated in the regulation. I will give the example that many health professionals may have the restricted activity of administering substances. And if it is granted as limited, the regulation will actually specify what that is. For example, administering oxygen. So it will be a limited restricted activity, and then the regulation will specify what that is. The third one is limited if certified. As I've said, that relates to a certification. So the college must establish a certification program if that's how the ministry has granted this authority in order for a licensee to actually perform the restricted activity. And it also can only be performed with the limit and condition that are being articulated in the regulation. So there are categories listed in that regulation, and under each categories, you will find a subset of restricted activities. Again, as I said, there's a total of 66. It ranges from diagnosis, procedure on a tissue, to administering substance or scheduled drug, inserting instrument, device, and fingers or substance. So if it's a limited restricted activity, it could be only some of these, or maybe only in specific contexts, wearable device, allergies, drugs, etc. Okay. Our regulation is called the Health and Care Professional Regulation. As I've said, it's our college-specific regulation. It now covers all of the profession that the college regulates. So as opposed to have 7 specific regulations, this is now in the same place. And it is articulated by profession. And under each profession, you find the information that is relevant to that profession. The regulation also includes at the beginning some general rules, such as who can use the title doctor. That is something that is being new. And that wording is the same in all of the regulation across the 6 colleges, unless you are also specifically granted within a profession to use the title doctor, which is the case for optometrists. Under each parts of the profession-specific section, you will also find the reserved title, the scope of practice, and the restricted activity granted to each profession. That regulation also includes the information regarding health profession corporation that is only currently applicable to physical therapists and optometry. So wanted to talk a little bit about scope of practice, just to provide a bit more context. So the approach ministry took in preparing these regulation was what we call mostly a lift and shift. So looking at the current scope of practice that were listed in the individual regulation and moving into that new regulation. There were some minor wording change, so it's not exactly the same, but it was meant to capture the same thing. It was not meant to change the scope of practice of the profession currently. A scope of practice in general, it's not meant to be an exhaustive description of health services, so it is normal that you will not see everything that you do as a health professional. It's meant to be something that is broad enough to capture the essence of what you're doing, and it's to help the college to guide establishing what it is that each profession are authorized to do, and also looking at unauthorized practice. As I've said, it's not meant to restrict how you are practicing today, and that is something that the ministry have also articulated in their FAQ that they have published on their website. A scope of practice may overlap with other profession. The model that ministry has taken, both with restricted activity and scope of practice, is that there may be overlap and that it is designed to support team-based care and balance public safety. I wanted to point out last week we hosted our webinar on standard of practice. You will find in the standard restricted activity that are being granted to each profession. So you will find the expectation of practice when it comes to restricted activity, but we have also made the matching of or the correspondence table of the 2 regulations. So when you look at each restricted activity, you will see which profession that we regulate as a college is being granted authority to do. And we've also added, you will see in bracket if it's limited or limited if certified or full. So being able, again, to connect those concepts that we've said so that you know if you need additional authorization, for example, or if you can perform it to the full extent, or if you need to refer to any limits and condition. I wanted to try addressing some of the questions that we've received to date, not saying that that will answer all of them, but we have been receiving some question on interpretation of restricted activity that is fairly new, especially the way it's been now articulated in those regulations. And I think all of us are still kind of learning and confirming what will be the interpretation of those restricted activities. So if you don't see a restricted activity listed for your profession, but you perform it in your practice, what does that mean? So could be 3 scenarios. First of all, how you perform it might not reach the threshold that is intended in the regulation. And an example that we have been actively discussing with ministry is restricted activity 28, which is ultrasound, which is written there. I don't know why I was trying to come up with it in my brain, but some health professionals do use ultrasound for therapeutic purposes in their practice. But in discussing with ministry, it is not reaching the threshold of the restricted activity that they have listed. That is for the purpose of diagnosing or imaging. And so therefore, that means that you are still allowed to continue doing that. If you are unsure the way you perform it in your practice, reach out that threshold. You're welcome to reach out to the practice advisor at the college, and we will continue to provide support on that. Scenario number 2 is that you may be performing the activity under delegation. You may remember that if a health profession is authorized to perform a restricted activity, if the college authorized in bylaw that they can delegate it to another health professional or an unregulated person, it needs to be authorized in bylaw. So for example, if the College of Physician and Surgeon were allowing physician to delegate specific restricted activities to other health professional, and that was allowed in bylaw, then that could be another scenario where that's allowed. Again, if you're unsure about that, you can reach out to us and we will do our best to guide you in there. The third scenario is that you may not be authorized. It is the ministry who set out restricted activity in regulation and who grants authority in regulation. And sometimes that may not have been granted to a health profession yet. And so again, if that's something you're unsure about, please reach out to us. So certified practice, which is a restricted activity that's been granted but requires additional authorization. Again, we've talked about this. That is set out in regulation by ministry. It is typically something that is not covered in the recognized education program for full licensure. And in regulation, it's specified that the board must establish a program that names the certification program, indicates the education, training, experience, and other qualification that the licensee must have to perform, the restricted activity, and the manner of assessing whether licensees are competent. The information on certified practice is in part 7 of our bylaw. It currently covers audiology, dietetics, hearing instrument dispensing, occupational therapy, and I'm putting an asterisk for occupational therapy because it is with the understanding that there will be upcoming amendments to reflect some of the current practice that OTs add, and we're not caught up in the regulation, and occupational therapists have received a notice about that information. So I am including the information here. Opticianry, optometry, physical therapy, and speech language pathology. The bylaw includes transition provision and process for PT and OT as of April 1st, because these professions were not brought under the restricted activity model under HPA. And so we recognized that we needed to have a process to grandfather people who had been practicing those activities. I am having a quick note here on fees. I know we have received questions, and I'm happy to get back to that later. The fee for certified practice were established during the fee restructuring process. It was based on certified practice that we had already existing for their profession. So we look at the cost of actually administering those requirements that we must have per the regulation. And so initial fee are laid out below, and the renewal. And we have also provided some information in an FAQ on that regard as to what do we base our fee on. Here we go. So we have published an FAQ on our website on certified practice. We know that for some profession, this is totally new. And so You can look on the website. It is on the HPOA tab, and then you can find all of the webinar actually. And we have specific categories on our HPOA FAQ and have created one that is related to certified practice. Okay, yeah, I knew I envisioned wouldn't have, so we'll have lots of time for question. Wanted to reiterate, so what's changing on April 1st? First of all, we have a centralized list of restricted activities. We now have clear categories of also restricted activity, as I said, under which you will find sub restricted activities. The college now has one regulation for all profession. All of the information is at the same place. Every profession is now brought up under the restricted activity model. So that gap has been closed, and we are now moving forward to be able to regulate all of the profession under that model. And we have new certification requirement for two professions. And those were the professions that actually were not yet brought under the restricted activity model, and those were physical therapists and occupational therapists. What's not changing? The application and interpretation of the scope of practice for the profession we regulate. As I said, although the wording might have slightly changed, it is not meant to change your scope of practice on April 1st, and that will continue to be. The protected title for each profession has also not changed under HPOA. And certification requirement for existing certified practice are also not changing. So that's staying the same. I think, yes, we are already at question time. And I know we had received some ahead of time, so I'm assuming, Michelle, you will start with those.
Yes, absolutely. I can start with the questions we received in advance. And I also just want to give a shout out to our team here of panelists from the college who are doing a really bang up job answering the questions through the Q&A feature. So some of those have been published to you folks. If you want to see some of the questions we've answered in writing, you can see responses from Susan, Lisa, and Chris in the Q&A feature as well. But yes, I'll get to the questions we've received in advance. A number of questions, Joanie, about the fees around certification, why this is required, initial fee and ongoing fee every year. I guess some of the professions may have had a process in place whereby they didn't have to pay a fee. And so there's some curiosity around the fee structure for certifications.
Yeah, so again, I think I'm going to start by acknowledging that, well, having to establish a certification, as I said, the college must include some specific things when we have to establish a certification, and that is in the regulation. So we don't get to choose that. That's the expectation of ministry, that the college will regulate a certification this way and include specific things in a certification. And so the college is complying with that. So there is a cost to establish those certification, to maintain them. So that there is a cost that we cover in the application fee there. We have an obligation to put the information on the registry, and therefore that there is a cost there. The third thing that I could add, which we have put in our Q&A on the website, is that typically higher risk activities, which certified practice and restricted activities tend to generate more complaints at the college and also require more resource development and guidance. So when establishing our fees, we do look at what resources will we need moving forward to regulate these things. And as I said, during the fee restructuring process, we had based our analysis on actual factual data of how much time staff had to spend to process these things and how much time did we spend on having to allocate time in other regulatory departments in order to oversee these practices based on how the ministry is requiring us to. I am aware that some profession were, either not overseeing this yet or maybe doing it differently. Same as we did for the fee restructuring process, we are looking at how we regulate it across all profession and making sure that we are bringing some consistency. And so we are doing that as a result of bringing on April 1st formal certified practice that includes all of these elements and having to maintain that on the registry moving forward.
Perfect. Thanks, Joanie. We also have a question here, just some curiosity around how the regulation came to be. Is it possible to share some background information? I know you shared a little bit in your presentation, but how did we, come to the regulation that we are anticipating for April 1st?
Yeah, so ministry owns the regulation. It is ministry who draft it, who decide when it is reviewed, and what are their priorities and what are their capacity in terms of making those revision. The college collaborates with ministry in terms of providing feedback and ensuring that the regulation reflects current practice as much as possible. Which is something we have been providing information on since the regulation was published last July. But in terms of how the regulation came to be, I can say, again, there's a portion that I would say is lift and shift from the current regulation that were existing, bringing every profession under the restricted activity model that wasn't done under the Health Profession and Occupation Act, and then ministry taking the lead on what the drafting is and what is the final result.
Thanks, Joanie. There's a question that's come in the chat and also one that we've received in advance about the certified practices for OTs. I know that we've shared that with OTs, but perhaps you could speak to the certified practices we are anticipating for them.
Yeah, so when the regulation was published last summer, there were no restricted activities that were granted to OT. So the college flagged to ministry that this was perpetuating the issues that we were not bringing OT under the restricted activity model, which was a gap under this act. And so there was collaboration and consultation with health authorities and the college in informing ministry as to what current OT practices were including. And so it is our understanding that amendments will be done prior to April 1st, which should be very soon, to include 2 certified practice for OT, which would include wound care and suctioning.
Thanks, Joanie. There was a question submitted in advance about increase in scope, and there's curiosity around whether or not the college will be pursuing any increases in scope to any of the professions we regulate over and above what you've shared today.
Yeah, so our role as a college is not to advocate for scope expansion. That would be the role of the association. Our role is really to collaborate with ministry in indicating how we can regulate scope expansion, and what's the best way, depending if it's entry level or not entry level. Ultimately, that remains the decision of ministry. Ministry has currently on their website a few expansion of scope consultation. And they, if I remember correctly, there are some wording as to how someone might propose this. And I know they're also looking to develop a consistent framework to be looking at this over the next couple of years. But it is really ministry who leads that work, and the college is a partner in informing how we can regulate this and how does that connect to a recognized education program, entry level, full licensure, or another form that needs to exist.
Thank you, Joanie.
Another form of oversight. Sorry, that wasn't very clear.
Thank you. I do have a question here about audiology specifically, and why isn't a registered audiologist required to be a hearing instrument practitioner certified to fit a hearing aid?
Yeah, so that is an example of something that is currently in the consultation by ministry as a change. in scope. And so if you look on their website, you will see that they are proposing to grant a new restricted activity to audiologists to that regard. So that consultation is open until March 31st and can be found on the ministry's website.
Thank you, Joanie. I'm noticing there's a question that's come in live and also one that we received in advance about the repeal of the video fluoroscopy for speech language pathologists. And so when we're in a situation now where we're adding certifications for certain professions, why we had to go the route of repealing a certification for SLPs several months ago, and wondering if you could speak to that.
Yes, so video fluoroscopy is not on the list of restricted activity in the new regulation. The new regulation requires certification for restricted activity, and that is the ministry who determines when a restricted activity requires certification. So that work had started ahead of time to be ready for that. And so we have kind of followed that model and what is required. So in that case, given that was not a restricted activity and not something that was listed in the future regulation to be a certified practice, the college, and that was deemed to be entry level for SLP, and that certification was repealed.
Thanks, Joanie. Another question in advance from a PT who's inquiring about what type of training is required to obtain a certification in reduction of joint dislocations.
Yes, so the college has not yet developed those requirements. It will be part of what we need to develop in the certification program. So people who are not currently performing that and will need to be certified in the future, that is something that we will communicate and will be available on the website so that people can look that up and be informed if they want to pursue a certified practice. For people who are looking to be grandfathered, we have also not pre-established a list of courses that would deem acceptable, but there are a couple of out there that are existing. If people want to chat about that, they could reach out to one of the practice advisor or the certification team at the college.
Thanks, Joanie. And then related to that, it looks like another question about one of the other certifications for PT, pelvic health. What are our next steps? So folks want to move forward with that. What can they expect?
Okay, probably a two-stage approach to that answer. First of all, if you are currently doing pelvic floor assessment, intra-pelvic floor assessment, bear with me as it's not my practice, so I might not have 100% the right terminology, but so April 1st, if you are currently doing that, we will be sending information as to how to apply for the grandfathering. We have provided in the notice specifically to PT what we will require in terms of information in order to be grandfathered. Obviously, there will be more information that will be on that form. And then people will have to pay the $50 fee that is along with it. And then people will be able to automatically be added on the registry and continue practicing. And we will be auditing a portion of these applications. After July 1st, it will be the new certification program that people will have to comply with. And so if you're not currently doing this and are looking to do this in the future, the college will develop the requirements. So that will be stage 2. Same as the question on joint dislocation, we will be publishing what will be the requirement and how people might be able to be certified, and that will be on the website. We are hoping to engage with subject matter expert in that area. We know there are some people who have lots of knowledge on that in that field, and we will want to involve them. So that is also to come.
Thanks, Joanie. I know you spoke just a few moments ago about the consultation that's going on with Audiology HIP. There is a question here about physical therapists being able to send out for x-rays or to request x-rays of a patient, and this one was specifically tied to the joint dislocation certification that we've got. I'm wondering if you can speak to that.
Yes. So in terms of the clinical requirement or approach of what needs to follow a joint dislocation, I won't answer that piece, but what how to process with a joint dislocation, what kind of tests might be appropriate or not after would be covered in the clinical component of the joint dislocation certification. Ordering x-rays for physical therapists is also something that is currently out for consultation with the ministry. And so that consultation is open until March 31st. How ministry will decide to move forward with this, like when those amendments would come, if they would come, and how they might grant that is something that we don't know yet. So I can't speak to how that would work and what could be the requirement for that yet, because that is still open. But in terms of understanding what may be the actual requirement and appropriate follow-up for the joint dislocation would be a clinical component of the certification program.
Thanks, Shoni.
And if some of my panelist member want to unmute and correct me because I'm not saying things exactly as I should or with the right level of nuance, like please do so. I'm kind of assuming that if nobody speaks after me, it's because they're satisfied with my answer.
Yeah, we've got a lot of good folks in the question and answers responding to all of your questions. So there'll be a lot that are responded to in writing that you'll be able to see. We're going to capture those and put them on the website as well, so that folks that are listening to this recording don't get the benefit of seeing those in real time, that they'll have another way to find the answers to those questions. I've got a question here, Shoni. What will happen if the HPOA is repealed by the legislature?
If I understand correctly, the question would be if like they decide to then like repeal it after it's become into force. Well, they would say what would happen. I can't exactly know like if they would replace it with something else, if they would want to go back to a former legislation. When something is repealed, it is typically replaced with something. So what it would be replaced with, it is not something that I could make a guess as of today. But we are on track to have this legislation come into force on April 1st, and the college has been preparing accordingly.
Thanks, Shoni. I have a question here. It says, if we are already practicing an activity that is now becoming restricted, is there a period of time in which we have to cease practice until we have been certified by the college?
So that depends if that activity is covered by a transitional provision. So if it's one of the new certified practice for OT and PT, for which we have a transitional provision, the requirement is that people do it as soon as possible, but the transition provision is meant to kind of capture that gap where not everybody may not yet be certified. If it's not one of these four, the two for OT and the two for PT, then the answer is yes, you need to cease practice until you are certified.
Thanks, Shoni. I'm just going through our questions. We've got a number that are awaiting a typed response from our team, so thank you for that. Question here, if I am creating a new dry needling course for, oh my goodness, physical therapists, it just jumped. Who will I need to contact within the college in order to apply for the course to be certified?
Can I ask Chris to help me out with this answer? Because I'm not very familiar with the process.
Yeah, no problem, Shoni. The college accepts course evaluations or conducts evaluations of courses every 3 years. This is 2026 is a year when we will be accepting submissions to be reviewed and then potentially put on the list of courses that we accept. That information will be out, I expect, later in the summer or early fall. So you just need to watch the website for that. And at the same time that we reevaluate the courses that are already on the list. So you can contact through certifications at chcpbc.org, but they won't be able to tell you exactly anything right now. You'll just have to watch the website for when that notice goes out.
Thanks, Chris. I kind of half knew that. I should have remembered. We have discussed that not that long ago, but thanks because you said that better than me. So.
I have a question here. It says, is it too soon to inquire about psychotherapy for counselors with designations? And there's a list of different designations. I know it's kind of off topic.
Yeah, I'm not entirely sure what's the question. So currently psychotherapy is included in our college specific regulation. They don't have, as of now, a restricted activity that is included. So I don't know if that was the question, but that's what I could say on that topic, I guess. Psychotherapy will become regulated in November 2027. That is something that the college will start working on after April 1st. So that's probably the best information I can share at this time.
Thanks, Shawani. Just looking for questions that haven't been answered.
I do see a question about diagnosis that I think Susan had flagged for me to answer if I understand this correctly. We know that currently in the college specific regulations, some profession have the restricted activity of diagnosing within their own scope of practice, where some other profession currently don't have that. That is something that we have flagged to ministry, like that inconsistency of having some profession that have that recognized as a restricted activity versus some others that don't. Again, the discussion with ministry is that the regulation hasn't been drafted with the intent to change practice on April 1st, and we recognize that all profession do make conclusion and finding at the end of their assessment, and that there are often the use of terminology diagnosis, like a nutrition diagnosis or a PT diagnosis. And as of April 1st, it's not necessarily meant to prohibit that. Of course, it hasn't been recognized and granted. So we would tell to people to maybe just kind of be mindful of how it's being presented and how it's being labeled. But we have flagged that to ministry, and the answer was that this is not intended to change how professionals are currently practicing and what type of conclusion and findings they are making as part of their services.
Thanks, Shawani. There's a question here. It looks like it's a follow-up to the question we had about video fluoroscopy and the repeal of certifications for speech language pathologists. So there's a follow-up question. Can OTs perform video fluoroscopy without regulation?
Again, yes, participating to a video fluoroscopy does not involve a restricted activity. So other health professional, if it's within their own scope of competence and have the required knowledge to participate in such an assessment and exam, can do so, as it's not a restricted activity. So this can include occupational therapists. It could also include dietitian, depending on which area of the province you're practicing. There's our different team composition. But yes, ordering the video fluoroscopy is a restricted activity that can only be done by physician, nurse practitioner. I think that's it, but the actual administering the actual X-ray of the video fluoroscopy is also a restricted activity that is done by the technician. Participating to that exam, using the result in order to guide your treatment plan if it is within your own scope of competence and you have the required skills of knowledge, then yes, it can be also done by other health professional than SLP.
Thanks, Shoni. There are a number of profession-specific questions here. There's one here around OTs who are also certified hand therapists, which encompasses a wide scope of practice. Can you please clarify how certified hand therapist certification fits into being acceptable for restricted activities? And would the college accept the certification as being competent? So is certified hand therapy contemplated in one of the two OT certifications that's coming April 1?
Yeah, so okay, we'll take a first shot at the answer, and Susan, feel free to add anything else when I'm done. So the restricted activity that will be a certified practice for OT, as we understand it, is wound care, which include certified hand therapy being done by OT. Again, we will have transition provision for those who are currently doing that. So if people have completed that kind of training in order to be competent and safe to do that, they will be able to report that as how they've acquired the competency in order to perform this now. After the transition provision, as of July 1st, what we will require in order to establish the new certification and how people might qualify for it in the future, including what type of courses and certification that might exist elsewhere already, is something we haven't completed yet. And similar to the answer I gave for PT, we will involve OT who are SME in that field in order to inform our decision. But that hasn't been completed yet. So I think that kind of covers it. Susan, I don't know if you want to add anything. Feel free to add.
Yeah, no, Joanie, I think you've covered that. Just that notion that we are aware that the certified hand therapists do quite a lot of wound care as OTs, and so that will be a consideration when we look at the certification program.
Thanks.
Thanks, Shoni. There's a question here. It says internationally accepted. Oh, is this the dietetics terminology? Includes.
Yes, it is. Yeah.
And we answered this one, right?
Did.
Okay. Sorry about that.
That's okay.
Is there anything in the Act or the regulations, I'm assuming, that speaks to what is in scope for dietitians as certified diabetes educators, or did that not get included as certified practice?
So I will assume that the question probably relates to adjusting and prescribing drugs in relation to being a certified dietitian. That would be considered scope expansion. At this time, it did not make the discussion with ministry. That would be future changes to the regulation that would need to be proposed and then consulted on, and that the college could then be involved in the conversation as to how we could oversee this.
Thanks, Shoni. I see at least two questions about folks that specifically pelvic floor physios that are really keen to make sure they have all their ducks in a row for April 1st so that they don't have any disruptions to their practice. And I just want to, is there anything we could do to assure those folks that we will have the information for them so that there is no disruption to their work?
Yes. So again, if you are a full licensee as of April 1st, so you have completed your renewal, so that's my plug. to make sure that you guys do that. So we will be sending out the information for the transition provision, if not on April 1st, on April 2nd, but we are targeting to send that on April 1st. This will allow you to go and complete your application form for the grandparenting. Just realizing I've said grandfathering the whole time, but I prefer to be gender neutral. So the grandparenting approach. And then during that transition provision window, people who were already doing this prior to April 1st can continue doing so until they've completed that application. If people are not currently doing this today, just so I'm clear, they should not kind of be doing this after April 1st. This is for people who are not brought in under the model and have been performing this for years. We will be sending the forms. You can complete them as soon as you can. It will be a very smooth process. You'll be added on the website. You need to complete this during the transition period. You are allowed to continue practicing those during that period. Once we have that cutoff, then people who have not completed it are no longer allowed to continue practicing it. So hopefully that kind of clarifies. We are providing a window because we do recognize that people will need the time to send in their information, and we don't want to be rushing that on April 1st. So we are providing that transition window to make sure that you do send that in and that you are processed and added on the registry as being certified to do pelvic floor.
Thanks, Joanie.
It will be an online form is the other piece I could add. So it will be fairly simple. You'll be directed to go complete the online form, upload document as needed, pay the fee. So all of that will be online.
Thanks, Joanie. Oh, there's still a number of questions left. We've either responded to them already or they're profession specific, or perhaps they relate to something other than restricted activities certification. So we'll answer them in another method outside of this webinar. There's one here, Joanie. It asks, is psychology the only profession without certified practices?
Nope. There are others too. And again, certified practice are established based if restricted activity are not entry level. Those were established by ministry. I would need to look at the name of our 9 profession to list all of them, but I don't think it is unless I'm mistaken. But regardless, the certified practice are established if a restricted activity is granted and not entry level, which might mean that for the scope of practice of psychology, the restricted activity that are being granted are entry level, which is not a bad thing. It avoids additional requirements that are being put on the profession in order to practice specific activities.
Thanks, Joanie. I think we've got through a majority of the questions. I know that there's still some that are being typed out. Yeah, I don't see anything new in relation to this topic.
Okay. If there are any very profession-specific question, I think I would encourage people to reach out to practice advisors so that we can probably go in the level of nuance and detail that you are hoping that we go into. And really that's why we have practice advisor to help guide practice and clarify information with regards to expectation and requirements in your practice. So I will thank everyone for their engagement. I'm glad we had lots of time for questions because then we could go into lots of details. We do recognize that for some profession, this is very new. What's new for all profession and the way this is organized and having that clear list and then looking at what's being granted for your profession versus others. Obviously, we're going to continue to communicate more, and based on the question we will be receiving from practice advisor, we can update our Q&A. And this was technically our last our last webinar of our HPOA series, but we have been discussing internally how we can continue to engage with licensees and also provide support as we transition under that new act. So we might be offering a follow-up webinar in the coming months, and we'll communicate something more about it in our newsletter or other channel. So yeah, thank you everyone for being here at the end of your day on a Monday, and have a good night.
Joanie, if I may,
Oh.
I just want to follow up on one question.
Sure.
That someone's flagged for me. It's in relation to the reducing joint dislocation certification for physio. When has this ever been allowed as a physio? If we can't, I may be looking at the wrong thing. If anyone on the panel is looking at the correct
Sure, I can jump in there, Michelle. It's a question about the restricted activity for physical therapists around reduction of joint dislocations. And I think the question is, how did this regulation come to be, given that it's not a common practice to reduce joint dislocations? And so I think that the point is, where did this restricted activity come from? How did that end up in the regulation?
Yeah. Well, I think to kind of connect this to some of the other questions we've gotten today as to, how come this profession doesn't have this or this one has this. It is really the ministry who is leading, developing, maintaining, updating the regulation. As I said, I know they tried to look at an approach of lift and shift, but then there were additional activities that were added. It was really the ministry who led that work. The college participated as a partner to kind of inform how we were going to kind of regulate these and if it was entry level or not, which was really something ministry was looking to understand in order to make their decision of how the regulation was drafted. So yeah. Okay, thank you for joining us, everyone, today. Just as a reminder, the webinar will be posted on our website, and we will be updating our Q&A in the next few weeks too. And thank you for your engagement.